Support for WUWM podcast comes from Hop Harvest and Vine and Good Harvest Market in Pewaukee, part of One Destination, combining farm-to-table dining, local craft beers, and organic groceries under one roof. More at goodharvestmarket.com.
Lake Effect brings you conversations about what's happening in Milwaukee and the people, places, and organizations that shape the community. This is Lake Effect Spotlight from WUWM, Milwaukee's NPR.
The rates of depression, anxiety, and PTSD are higher among physicians compared to the general population. Unfortunately, this problem isn't improving, as at least one physician in the U.S. dies by suicide every day. Despite the proven effectiveness of treating mental health conditions, most physicians don't seek help. So why does this treatment gap exist, and what barriers are preventing it from closing? Dr. Jesse Ehrenfeld looked into this issue firsthand and co-authored a study that shares a few solutions to reduce barriers to mental health care for physicians. Dr. Ehrenfeld joins me now to share more and starts by explaining why mental health challenges are prevalent among physicians and others in the medical field. As a note to our listeners, our conversation has mentions of suicide.
You know, we've got a bunch of problems. Stigma. Unfortunately, in America today, it's not okay to raise your hand if you have a problem, and that extends to physicians and other healthcare professionals. And the culture of medicine just has not changed today to allow people to ask for help. And unfortunately, we find ourselves, I'm a physician, I see patients a couple days a month, working in a system that unfortunately is full of systematic challenges, frustrations, moral injury when I can't get the care that my patients need because the insurance company denied it. All of those things create an environment that unfortunately leads to a lot of physicians having mental health challenges higher than we would expect based on population statistics.
Obviously, you've been through this process yourself. You've had multiple roles, but you are a physician. You know these problems intimately. So can you share some of your motivations to actually research this topic and co-author this study and dive into it in an academic way?
Yeah, for me, this is deeply personal. I lost a med school classmate, a resident in one of my training programs, and a colleague in one of my practices to suicide. And each of those deaths haunts me. And I think not just about my colleagues that I lost that aren't here and their families. I think about the thousands, hundreds of thousands of patients who will never be cared for by them and what that means for the health of our state and our nation because this problem extends everywhere. So for me, I know there's more that we need to be doing so that it's okay to raise your hand and ask for help when you're at that point, regardless of who you are, and that we make the systems easier for people to work in so they don't get to that point to begin with.
I'm very sorry for all of your losses, and unfortunately it's something that will continue. I feel like COVID brought this issue of physician mental health into a larger focus, but it hasn't really improved since then, right? So what are the barriers that deter or can even prevent physicians from seeking help?
So they're logistical barriers, and I feel this. You know, physicians don't call in sick. I don't want to let down my patients. You know, I'm an anesthesiologist, and if I'm not there, surgery is not happening. And the burden that creates for families, for patients who took time off, got things organized, or expecting to have their procedure done, for my colleagues, or my colleagues may have to step in if I'm not there. People don't call in sick. There's a culture that expects you to show up. I don't want to let people down. And yet, you know, I think we did realize during COVID that you shouldn't show up if you're coughing on people, that you should take that day off. But unfortunately, that still just doesn't happen. And so, unfortunately, the time constraints around, well, how do I actually get help for myself? You know, it's a little easier now with, you know, telehealth services and things after hours. But most medical services are, 9 to 5. Try to get an office appointment on a Saturday, especially with a behavioral health specialist. Good luck. There are also a lot of concerns about confidentiality. Most of our healthcare systems in the state have very well-developed employee assistance programs where there are resources, there may be counseling, there may be professional psychologists or psychiatrists, but people are afraid to use them. They're afraid that their colleagues are going to find out, that they will lose confidentiality. And we've seen this. We've seen this play out in Wisconsin. There was a wonderful program that is being sponsored by the Wisconsin Medical Society using a telehealth platform that's very specific for physicians. As soon as they rolled that program out, and I don't know all the details to their members, they saw immediate uptake. And that uptake, just based on who it was made available to, was from physicians in health systems where there are very robust employee assistance programs. So we know that there's this unmet demand out there. A lot of logistical barriers, confidentiality constraints, time constraints are preventing people from getting the help that they need.
Well, and outside of logistics that I feel like we all struggle with, and then physicians tenfold because your days are so packed, but there are actually professional consequences, right? If someone seeks out help, if, like you said, the fear of someone knowing that they are going through a mental health struggle could reflect poorly on their professional outlook.
Not only reflect poorly, one could lose their license or not be credentialed to work at a hospital. And for decades, every time a physician fills out a licensing application here in Wisconsin, anywhere in the country, a very broad, very intrusive, very inappropriate question has been asked. Have you ever, at any point in your career, received psychiatric, psychological counseling help or been hospitalized at any point? Now, questions that ask about current impairment, fine. But I'll tell you what happened to my friend Miriam. We were residents together, and she's incredible. Gifted physician, one of the best. She graduated and went to get her medical license in another state. She actually checked the box that she had received help. She had gotten counseling in high school. She's an incredibly well-adjusted, high-performing physician with no impairment or problems. That held her license up for 6 months. People know that they're going to have to answer these questions. They know that when they get privileges at a hospital, they have to answer these questions. And so when they recognize that they need help, they're reluctant to do so. And we're starting to see change. And there's been a huge national effort here in Wisconsin, across the country, to get health system credentialing forms changed, to get medical licensing form changed, and do it not just for physicians, but for all licensed healthcare professionals, because it's just not okay to have these intrusive questions.
I want to talk about culture, too. For physicians and people who are studying to become doctors, starting in med school through residency to wherever they end up, what is the culture like in healthcare settings when it comes towards attitudes about mental health? Because it is a high-stress environment. No one doubts that. Everyone knows there's stress. There's high pressure. There's always the pressure to perform, to get accepted into your next steps. And we can only assume, yes, everyone is stressed. Maybe there's other mental health problems, but is it just not something you talk about, even with your peers?
It's not. We reward stoicism. You're expected to be, quote, a strong student, a strong resident, a strong physician. I cannot tell you the hundreds of times I've heard those exact words uttered from my colleagues, my faculty, my peers, students who want to be seen as that. They want to be seen as somebody who doesn't have vulnerability, which is not the reality. We all have vulnerability. We all have moments where we need help, where we need to take a day off, where something's happened in our family and we need to take care of ourselves. But that's not acknowledged historically. And we're starting to see that culture shift, but it hasn't happened fast enough, and there's a lot more that we need to do.
You can speak just to your personal experience here, but do physicians feel like their mental health needs to be triaged, like it's only to be addressed when it gets too bad to ignore?
Unfortunately, we see a lot of physicians who self-prescribe, who try to take care of it on their own, which is never a good idea, who ask a peer, often inappropriately, to help take care of themselves because they're worried about sort of going through the system as it is today because of confidentiality or other kinds of things. And those things obviously need to change. And there are a lot of opportunities, right, to bring on board strategic solutions that can not just reduce stigma, but make it easier for everybody, including physicians, to access behavioral health services.
Yeah, as you mentioned, to put a number on that comment, your report cited that 75% of interns expressed a preference for self-managing mental health conditions. And this attitude starts off early on in the process of their medical career. So when we look at the big picture, the institutional challenges, because of this, do you think there needs to be longer-term changes to, say, the residency system to set up physicians to help reduce these extra stressors that contribute to a decline in mental health?
I think there have been some good reforms in our training programs, and there are national standards that require training about recognition of burnout, recognition of needing help. But just because you go through the training or you click through the online module doesn't mean that you're actually willing to do that. And I think that there's an important role that physicians who are in practice have to model that behavior. And we're starting to see that. We're starting to see that certainly in the places that I've worked, in the places that I've spoken with around the country. But again, it's not happening fast enough. And unfortunately, every day that goes by that we lose another physician, another nurse, another dentist, another pharmacist to suicide is too many.
And with big institutions, there's also differences of implementation, right? There's state, federal, there's differences of schools. I imagine that's a massive problem because none of this is going to be like a blanket, consistent thing. No matter where you go to med school, this is the program you're going to get.
Yeah, if you've seen one medical school, one training program, one hospital, you've seen one hospital, one training program, one medical school.
Yeah.
And every place has a different approach to this, a different culture, different systems in place. We're starting to see some efforts, and we're funding some of those efforts here in Wisconsin at the Advancing Healthcare Wisconsin Endowment to create a shared framework, shared measurement, shared systems, but it hasn't really happened at scale today.
We can talk about Wisconsin, and before we get into this, I'm just going to take a moment to reintroduce you. This is Lake Effect. I'm Audrey Nowakowski, speaking with Dr. Jesse Ehrenfeld of the Medical College of Wisconsin, and we're talking about physician mental health. So given that things are going to change depending on what school, what hospital, what state you're in, let's focus on Wisconsin. And you mentioned one resource, but what other resources are currently available for physicians? I know there's programs like SOS Peer Supporters, but that's people who volunteer to be support. But is there work to be a separate entity that is there for physicians?
Yeah, so today, Wisconsin is one of 3 states that does not have a physician health program, a confidential place that folks can go when they need help. 47 states have one, we don't. And we need that. But we don't just need it for physicians, we need it for everybody. There's one state in the nation that does have a universal program for all licensed healthcare practitioners. That's Ohio. And the Advancing Healthcare Wisconsin Endowment made a $2.5 million grant to the Wisconsin Medical Society to work with all of the health professionals associations around the state and the state to bring online a program that can service everybody. And we're really excited about that. We think that's a really, really important step because we need someone that if you're a nurse who's depressed, if you're a physician who's suicidal, if you're a pharmacist who's having a drug problem, you have somewhere confidential that you trust to go. And I think it's one of the most important investments that we've made in this space.
Let's talk about wider implications. When it comes to mental health challenges among physicians and everyone who is involved in these healthcare systems, it's truly like a public health issue, right? Because it trickles down. How does it widely affect everyone they interact with, no matter the level?
Yeah, so physician mental health is not just a workforce issue. It's a public health imperative. When our caregivers are suffering, our patients suffer too. And we can't have a healthy, thriving community state if we don't have a healthy, thriving workforce to take care of them. When physicians are depressed, quality goes down. When people are having struggles, then you may be absent from work. We see this in any industry, but that has profound implications for the health of our communities when it's the healthcare workers themselves who are struggling. So the frightening and frustrating part is despite the effectiveness of cognitive behavioral therapy, of mental health treatments, most physicians don't seek help when they need it. And we've seen that survey after survey after survey. People who know that they're at that point, 6 out of 10 don't get the help that they need.
What do you see as the biggest limitation right now?
So again, I think it's stigma, it's culture, it's fear of professional consequences, and the logistical barriers. We just have not made it easy for people to get the help, even if they're ready to.
How do you think we can change the culture, especially on such a wide scale? It's this institutional norms, right, that we're fighting against.
I think there are definitely things that we can do, and some places have flipped the model. Instead of raising your hand in residency program and saying, I need some support, I need some help, programs have implemented these opt-out sort of paradigms where they normalize mental health engagement by making it a routine part of training and scheduling everybody for a 20-minute check-in. And you can opt out of it, but the default is that you're going to go talk to somebody about how things are going, to do a quick screening to see if there's anything that maybe needs to be addressed. So I think that's really important. There are definitely opportunities for modeling, from leadership when a leader shares their own mental health struggle or their challenges or their journey. That breaks the stigma and that builds trust. And I've seen that in many cases. And I think that that's a really important way to change the culture.
Especially when it comes to newer doctors and, people just entering med school. What would you recommend to them to try to move this needle if, they're afraid of maybe that their professor or their doctor is not modeling the same behavior?
Well, again, I think one of the most important places to get support is from your peers. And, I was lucky. I had a lot of challenges in medical school. I did fail an exam once, and I thought it was the end of the world. And I still remember a faculty mentor, put her hand around my shoulder and said, it's going to be okay. I remember the day in residency, and I was like a senior resident near the end of my training, and I didn't get something right in the operating room, and I kind of got scolded for it. And one of my faculty said, well, I can't believe you're not operating at the level like a junior person. And I bawled and I broke down in tears. And I still remember wandering into a trusted colleague's office and just losing it, and her, picking me back up, telling me, you're going home. That's it. And we'll revisit this tomorrow, and being there to help me through. And so for folks who are out there, I think regardless of your profession, regardless of where you are, finding those peers who can support you in those moments, because we all have them, right? We all have bad days. We all have moments where you just need somebody to give you a perspective and tell you it's going to be okay. And that may be a spouse, that may be a family member, but it may be somebody at work or that you can trust.
So to localize this, given that things change depending on where people are listening, what would you recommend someone in the Milwaukee area? They're struggling, they need a resource, and they're not comfortable seeking it out in their workplace. Where should they go?
I got to tell you, the 988 crisis line is an incredible resource. And what's great about that is it's easy to remember, it's universal, and it's a place to connect, right? It's not a particular resource, it's a connection point. And it's pretty good. We've done a lot of work to shore that up across the state of Wisconsin. There's always work to do. There are gaps. But I would tell you, anybody who's needing a starting place, that's a great way to dial in.
Well, Dr. Ehrenfeld, thank you so much for joining me today to talk more about this very important issue. I appreciate your time and sharing your experience.
Thanks for having me.
Dr. Jesse Ehrenfeld is the Executive Director of the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin, where he's also a tenured professor of anesthesiology. You can find the study Dr. Ehrenfeld co-authored about reducing barriers to mental health care for physicians, as well as links to resources at wuwm.com.
You can find more interviews like this one by visiting wuwm.com/Lake Effect. And while you're there, subscribe to the Lake Effect Spotlight podcast.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.